Okay. Discuss, Mary, the family background and history briefly. How was your pregnancy with Michael?
At 6 weeks, I started staining, and I went to the doctor, and that's pretty much around the same time I found out I was pregnant. And it was between 4 and 6 weeks that I started staining, and they put me on bed rest, off and on, for until it stopped. So that was another 3 or 4 weeks, and then after that, it was a normal pregnancy.
Really? Okay. And then...
Normal birth. He was born 2 weeks before my due date, just like my first one was, and it had an epidural, normal childbirth.
And then his infancy. So then when
He was a really good baby, opposed to Joseph, who was my first one, who's 2.5 years older. Joseph was colic, and Joseph every 20 minutes wanted to move around. He didn't like staying in one place. Michael would sit in that infant seat all day long if you left him, and we just thought he was a good baby, and that's what babies did. And then he had a lot of ear infections the first year, and we noticed around 10 months the babbling was stopping.
he was cooing and kind and smiling and everything, and then it just stopped.
He would look when you walked in the room, but then he didn't really follow you around the room the whole time. But he would notice when somebody walked in and out of the room. But once you were in, he didn't. If you didn't play with him, he was perfectly fine just sitting in the seat.
Wow. So then when did you realize?
When I went for his 12-month checkup, I told the doctor what I was noticing with the babbling. And she said that if I had that mommy gut feeling, to call early intervention and let them take a look at him. So we called early intervention. It was probably a week or two later. And by the time they came in and evaluated him, it was between 14 and 16 months when services started.
Who came in and evaluated? In the home?
In the home.
In the home.
They came in the home. It was a teacher and a speech therapist came in. He wasn't speaking at all at that point. Where Joseph, my older one, at 9 months old was talking, and at a year old was speaking in sentences. So that's all I kept comparing Michael to. Michael was evaluated, they thought, because of the fluid in his ears from the ear infections, that he didn't know labels of objects, and maybe that's why he wasn't speaking. So they started with speech therapist.
Okay.
The speech therapist then would only sit and work with the speech therapist if he would sit in my lap and she would rub his feet in that deep pressure. And her sister happened to be an occupational therapist, so she told her sister about Michael, and her sister said he needs an occupational therapy eval. And from there we went to full-blown services and looking into an autism diagnosis.
Would he look when people were in the room? Would he watch people in the room or no?
Depending on what they were doing. If Joseph was jumping around the room, yeah, he would watch him, but not all the time and not for the whole entire time.
And did he play with anything?
He played with toys, but it was more parallel play.
Okay.
It wasn't interacting.
Okay.
He would do a little. If you initiated it, he would do it with you, but he wouldn't never initiate play with someone else.
Okay. And would he pick up a toy and play with a toy?
Yes.
He would. Okay. What was the reaction? So when they thought possibly at the age of 12 months that
it was just speech at that time.
Just speech at that time.
At that time, and then we brought the occupational therapist in, and then they brought a parent trainer in.
Okay.
And the parent trainer is the one that really kind of watched him and thought that it was more than just a speech delay and sensory. He had a lot of sensory issues. So he was a sensory seeker. As he started to get older and run around, he would be the perpetual motor. He would run, he would climb, he would constantly be on the go.
Scale the wall?
Yes. He'd
Scale
scale
the wall.
doorways.
Scale the wall? And then that was at before the age of 3, of course.
Yes.
Okay. And then what did you have an IFSP? IFSP.
Yes. That was all through early intervention.
Okay. And then what services did he have then after?
He had speech. We used to get 3 times a week. Occupational therapy was twice a week.
Mm-hmm.
and the parent trainer used to come once a week.
Wow. And then did he progress with speech at all, or nothing?
He did not say his first words until he was almost 4.5. So he would make some sounds. We taught him some sign language. When he eventually went to a special needs preschool, they started using the PECS, the picture exchange system with him. But he did not say his first words till after he was 4. The occupational therapy worked very well, got him to sit and attend better, taught us what he needed so that he could sit and attend better. And the parent trainer was key in helping us understand where this was all going.
Knowing you're going down the road that
He
possibly...
was a psychologist from the Islip School District, West Islip School District. And he would come to my house once a week, and he would talk to me, and he would just watch Michael. And he was licensed to diagnose, but he wasn't contracted to diagnose.
Okay.
That wasn't the reason he was coming to my house. So he knew ahead of time what the diagnosis was going to come back as. So he prepared us for it.
So where did you go to get the diagnosis?
We went to the Cody Center for Autism at Stony Brook. And it was a series of 3 visits. It was one visit where they just talked to my husband and I and took our history from the minute of conception until the present day. And then they brought Michael in and they gave him the ADOS. And as much as they could, or he would, perform that day. And then the third one, his preschool teacher had come back because he was 3 at the time.
Okay.
His preschool teacher, I believe, came with us. And that's when they gave us the diagnosis. Because they wouldn't actually label them until they were 3. And then after that, we brought the neurologist and we started seeing a neurologist.
So when the Cody Center is the one who
Yes.
gave you the diagnosis.
Yep.
What was, as you prepared yourself for that, what was your feeling after it was officially told to you that...
I knew it was coming because the parent trainer had told us all this. I had read books about it. But when you hear a stranger say it, your whole world, everything just goes black. Your whole world changes. It's nothing like hearing a stranger actually confirm what you think at the time is your greatest fear.
What was your parents' reaction?
My parents were very supportive. I think they were more concerned for what my reaction was, so they were trying to be strong, but they've always been accepting. They've always wanted to be there when he was having therapy and learn what to do and how to interact with him. So they've always been...
So you had the support from your family.
Yes.
And then Anthony's family? Were they
They were supportive, but they also just thought he was a boy and he'll be fine. They were more afraid to say there was something there. They just wanted, it's okay, he'll be fine, everything will be okay.
Denial?
So, a little bit, yeah.
A little denial?
Yeah.
Joseph, what about Joseph?
Joseph?
Did he understand? Because when he was diagnosed, Joseph was
5.5.
Okay.
6.
Okay.
It was hard to explain it to Joseph why people with bags of toys kept coming into the house to play with Michael, and nobody with bags of toys was coming into the house to play with him. So sometimes the therapist would incorporate Joseph into some of the therapies. We set Joseph up in his room with VCR and a television and things like that, so that he would be occupied while Michael was. They were working with Michael. We scheduled special dates that him and I went on, or Anthony and Joseph went on. So he had special time with us because he saw how much time we were giving Michael. It was hard for him to understand. He always wanted to know why his brother didn't act like his other friends, brothers and sisters. And I remember when Joseph was in preschool, going to play dates with him. And as soon as the other kids that he was playing with that were Joseph's age started to say, how come your brother does this? Or how come your brother doesn't do that? Joseph would come over to me and say, can we go home now? I'm done.
What was Michael doing?
Like, I'd have to follow Michael around all the time.
Okay.
Michael would be trying to climb on things and get into things. I couldn't sit there and have a cup of tea with Mom while the boys were playing because I had to follow Michael around. Or we went to the park and I would be, running after him all the time, and their siblings were playing with them. So, once it was obvious to the younger kids that there was something different. And as soon as they started bringing that up to Joseph, Joseph would be like, okay, I want to go home. I don't want to talk about it with anybody. But we tried to explain to him that Michael's brain works differently and he thinks differently. And we just have to teach Michael's brain how to work like yours. I mean, how can you tell a 6-year-old? I don't know how to explain it any other way to a 6-year-old.
Did Michael have any behaviors? Outbursts at all at the age of 3?
Oh, yes. He was very frustrated.
Because he was nonverbal.
Because he was nonverbal. And it was very frustrating when we didn't understand what he wanted. Many a time sitting on the kitchen floor and he couldn't tell us what he wanted. And I couldn't figure it out based on what he was pointing at or telling us. That we would both be sitting there in tears. Because I just didn't know what he wanted. He started with flat out on the floor tantrums when the frustration level just got too high. It could be anywhere from 3 to 6 a day, depending on how well we were able to understand each other. And that lasted 3 and 4 years old. Once we got to like kindergarten, it was less. And then first grade, it was less than, it kind of faded off. The more speech he had and the more means of communication he had, the less the tantrum was.
Did you use the PEC cards at home then also?
We did.
We did.
When he was in preschool, he had started the PEX cards, and we had a board at home in the dining room with all of his cards.
Right.
We had a book that we used to take with us out, and he had his book at school. So once he was able to communicate with that more with us, then we saw less tantruming.
So after when he had his IFSP, and then you switched over to his IEP with the school district, what was the process dealing with the school district to give it the IEP?
We had a very nice chairperson at the time in North Babylon, Dr. Henry Tanners, and he was very much for whatever the kids needed, and he had said, well, he was the chairperson when Michael went into preschool.
Oh, go ahead.
Preschool. When we were switching, and he was very nice. He's the one that told me cut the cord at the curb, not at the classroom, that I needed to put my nonverbal, almost 3-year-old son on a bus and send him to preschool.
He went up by himself on the bus? By
himself on the bus. He had an aide. There was an aide on the bus, but there was an aide for all the children, one aide for all the children on the bus. But he took the bus to preschool every day and took the bus home, and he wasn't potty trained and he wasn't verbal, and that was horrible to put him on the bus.
How many days did he go every day?
He went 5 days a week for 4 hours a day.
Okay.
It was in the morning. He was there.
At the age of 3?
At the age of, it was right before his 3rd birthday. He started July 1st. He started preschool, and he turned 3 at the end of July.
Okay.
And he did that for a year, and then the second year, it was still the same preschool.
Okay.
But they had added an ABA component. So he had half the day he had ABA, half the day was in the classroom. And I had a teacher that came to my house 2 hours a day that did more ABA with him.
After preschool?
After preschool. And I went up and I had the speech therapist, the occupational therapist, and the ABA teachers teach me what to do at home. So at that time, now this is almost 14 years ago, they were saying 40 hours of ABA was optimum. So Michael would get 20 hours between school and the home services, and I tried to make up the other 20 hours myself.
So my next question was, what were the parents' involvement in the process? You were the teacher.
Yeah.
You were the second teacher.
When we did the ABA, I didn't track it in a book, because God bless those people. They have to be an octopus to do everything, and to make Michael sit still. We used to have to corner him. Literally corner him with the table so he couldn't get up and run away. But I used to learn how to do it. So I used to work all of the golds with him. He used to bring his binder home every day, and I would work everything with him, and even the speech and the occupational therapy. I recreated everything at home. We recreated everything at home.
You and Anthony both.
Yes.
Wow.
Just so that he got as much as, we just felt that the more that he got, maybe the better off we would set him up for kindergarten.
So what? So then he did the preschool until he was. He did
preschool
3
for
years.
2 years.
2 years.
2
3,
years.
4,
And then
fi-
he turned 5 in July and started kindergarten in September.
in September. And what was the program they went into?
That was an ABA based kindergarten program. They had an hour and a half of the day was built into, if they needed to do discrete trials, they were able to do it, but he didn't need it. He was able to generalize very well. But for kids who couldn't generalize, there was an hour and a half of the day that they could get discrete trials. But everything they did through repetition, very much like the ABA. So when they sang the circle time song, every kid got to sing it. So they heard it 10 times. They didn't necessarily have to sing it themselves 10 times.
They heard it.
Typical ABA would be.
Right.
But it was all that. It was all based on the ABA concepts, and he did very well with it.
And then how many? That was full day.
That was full day kindergarten.
6
full
hours?
day kindergarten. Yeah, from
From when it was 6
9 to 3, whatever.
hours.
Yeah, and that was in a mainstream elementary school.
Did he get services at home after 5th grade? Or, I mean, after 5th grade.
No.
After kindergarten, when he started kindergarten, no services were at home
No.
then.
He was able to get everything he needed in school.
Okay.
And then the teacher would send homework. And again, I went to school and I spoke to the speech therapist and I spoke to the occupational therapist and told them, what are you doing? Send it home. Let me do it at home. And I would just work with him at home.
So then, what were the challenges working with? Let's say we hit all his surfaces. He had OT, PT, speech.
No PT.
No PT.
OT, speech, and the ABA when he was in preschool.
So what were the challenges working with those specialists?
They were all very accommodating. They were thrilled that I wanted to help and I wanted to do things. They sent home some stuff for me to use. Some of the things I was able to recreate myself. Some of his things he needed for the therapies. They were very accommodating. They loved the fact that I wanted to come and help and be involved. So they were very nice to me about everything.
And that's wonderful, Mary, because you're a wonderful mom.
Well, I wanted to, all we wanted to do was get as much as we could into him as early as we can and hope that gave him an edge and helped him. You know, it was always my thought when he was in early intervention to give him as much therapy as we could so that maybe we didn't need a special needs preschool and then we needed the special needs preschool and then my goal was, well, maybe we won't need a special needs kindergarten if we get him as much as he can. And then by that time it was kind of, you know, this is it, we're in here for the long haul, but we're still going to get the best that we can.
Right.
So if we always shot for, like the saying says, you shoot for the moon and if you land amongst the stars, okay. But we just always thought, I'm not going to live forever, and that's a fact. And he has to survive without me at some point. And we don't want him to be a burden as little as he has to be to Joseph. So we just always thought the more we could do and the more we could give him, the better off he would be. What
are the joys of raising Michael and seeing Michael become who he is?
It slows you down sometimes, and just little things that you take for granted, you appreciate more.
His sense of humor.
You know, even though most parents would not be happy if your child spoke back to the teacher. We were thrilled that he spoke back to the teacher because what he said was appropriate when he said it.
Right.
It was typical sometimes of that age. When he did something that was typical for his age, even if it was a bad thing, you still took pride. Like, wow, he did that. You know, he did something typical. Just to see him get excited that he did something that we have discussed with him over the years about the disability, and he is not always been accepting of it. And sometimes I think inside he really does know he's different, but he doesn't always want to admit that he is. So he gets excited sometimes when he does certain things. That's like, hey, I didn't know if I could do that, and I did it. But it definitely, as a parent, slows you down and makes you appreciate some of the little things.
What are the frustrations? with Michael?
Um,
Or not?
watching everybody else's kids progress and move on, and yours not. Hearing other kids his age speaking in sentences and have never heard your own son's voice. It's hard. It's hard sometimes to sit in a group and everybody else is sitting down and the parents are all talking and the kids are all playing and you're running around like the village idiot after him because he won't stop and he won't sit still like the other kids.
And he's
climbing on the back of the couch and he's hanging over the steps or he's trying to run out into the street. So yeah, you can't always sit down and be an adult like everybody else.
Right. How does Joseph react to Michael? When he was little, we knew that.
Well, when he was little, he would try to play with him. And if Michael played, that was good. And if Michael didn't play, he would be like, okay, I tried, and he would move on. It bothered him when he was around other kids.
Right. Adolescence.
But it was a little harder because Michael required a lot more attention.
Right.
And I know it was hard on Joseph. And he was not always wanting to go places with Michael. Because Michael would always be trying to, even in the carriage, would be trying to get out of the carriage and run away. And it was always kind of a scene. And that Joseph would get embarrassed.
And what about now?
Now he's a little more accepting. Sometimes he'll tell kids, I'm just letting you know, my brother's coming and he has autism. So don't be surprised if you see him do this or this. I don't know if he fully realizes that later in life he may have to help him more than he knows now. I'm not sure how much of that he understands. We kind of have talks about it here and there, but he doesn't really want to talk too much.
Talk about that. Right?
No, and we're trying to set Michael up where Joseph still has his own life. And he may have to look in on Michael, but not live with Michael and take care of Michael and change his life all because of Michael. But it does definitely affect Joseph.
What are your hopes and dreams for Michael?
That he wins the lottery. I'd like Rain Man with the numbers. No. I want him to be happy. I want him to have a job that he enjoys. I want him to have friends that he could go out with. I don't want him to be alone. Just do whatever makes him happy.
What makes him happy?
Right now?
Video games?
The
computer?
The computer. He likes to go to museums. He likes to go to the movies. He likes Legos. He loves his Legos. But I'd like him to have a job that he wants to go to, not that is a chore. So I want him to do things that make him happy.
Does he have any idea what he wants to do, Michael?
He wanted to be CEO of Lego, but they're based in Norway, and he doesn't want to move to Norway. He wants to stay in the house that he grew up in. So no, he doesn't. No, right now we're working with adult services right now, so we're trying to figure all that out. But I'm afraid if he works in the Lego store, he would come home with plastic and not a paycheck. If he get paid in bricks, we wouldn't get a paycheck.
Your house will be made out of Legos.
Legos, yeah.
Legos.
Yeah.
All right.